so frustrating and it's sad, and we, talk to families all day, every day who are losing someone from an overdose.
Dr. Sterling McLaren looks death in the eye every day.
Yes.
As Denver's assistant medical examiner, McLaren sees the impact of drug use and overdose firsthand.
Every number is a person.
Data shows the number of people who died from an overdose last year dropped from a record high of 598 in 2023 to 483 in 2024. It's a 20% dip.
It felt optimistic. If we see the numbers going down, we think that's a good thing.
It's not the only change their office clocked.
For the first time, 2024, we saw methamphetamine take the lead over fentanyl by about a couple of cases. So methamphetamine is not going anywhere, and it's in fact kind of on the rise and causing just as many, if not more, deaths than fentanyl.
Often meth and fentanyl are being used together. As meth use climbs, McLaren says fentanyl is still in the community. How it's showing up is shifting.
Fentanyl used to be really commonly found as a blue pill. Recently, we've been seeing it in the white powder form. And so that's something that I think is concerning, because a person may use a white powder, which is typically cocaine or heroin, or think that it's not fentanyl when it is fentanyl or has fentanyl in it.
While last year's drop in deadly overdose deaths is a relief, McLaren warns it may not last.
Unfortunately, we are seeing an increase in our overdose-related deaths. March of 2025 was the worst month we've seen in recent history.
While deaths in June have dropped, she's still concerned by that spike. McLaren says addressing addiction, substance use, and overdose deaths is a complex problem, one they try and tackle every day.
We're hoping that what we do here contributes to the greater understanding and prevention efforts eventually.
Lisa Rayville with the Harm Reduction Action Center says she's pleased that 2024 brought a drop in deaths, but says there are still far too many. And a substantial rise in deaths this March and April has them worried. She says people they know, love, and serve are dying preventable overdoses, so they're trying to continue to support people who use drugs with health information and access to naloxone. Rachel Browns, 9 News.